Question 1. A patient presents for a scheduled follow-up for hypertension. During the visit, the patient also complains of a new, painful skin lesion on their arm, which the physician evaluates and then removes via cryosurgery in the office. Which modifier is necessary to append to the evaluation and management E/M code? A. -24. B. -25. C. -57. D. -59. Answer B. -25. This scenario tests the correct application of modifier -25. The keywords are new, painful skin lesion evaluated during a scheduled follow-up, indicating a separate issue from the planned visit reason. Modifier -25 is appended to an evaluation and management E/M code when a significant, separately identifiable E/M service is performed by the same physician on the same day as a minor procedure. Here, the hypertension follow-up is the E/M service, and the lesion removal is the procedure, so using -25 shows the payer that the E/M visit was distinct from the preoperative work of the procedure itself. Think of modifier -25 as signaling two services in one visit, the planned E/M and an unplanned procedure. Question 2. According to 2021 E/M guidelines for office visits, which of the following is not one of the three elements used to select a code level based on medical decision-making, MDM? A. Number and complexity of problems addressed. B. Amount and/or complexity of data to be reviewed and analyzed. C. Risk of complications and/or morbidity or mortality of patient management. D. Detailedness of the physical examination. Answer D. Detailedness of the physical examination. This question tests knowledge of the core components of modern E/M coding. The keyword is not, asking you to identify the element that is no longer used for leveling office visits. The three core elements of MDM are the complexity of problems, the amount of data reviewed, and the risk of patient management. The level of physical examination, while still a required part of the service, is no longer used to determine the level of an office or other outpatient E/M service since the 2021 guideline changes. The takeaway is to focus on the provider's thought process, MDM, not just the physical actions, for modern E/M leveling. Question 3. The term nephrolithiasis refers to a condition affecting which organ? A. Liver. B. Gallbladder. C. Kidney. D. Lung. Answer C. Kidney. This question assesses knowledge of medical terminology by breaking down a complex word. The key is understanding the word roots. Nephro- refers to the kidney, and lithiasis means the presence of stones, so nephrolithiasis literally translates to kidney stones. Knowing common prefixes and suffixes is crucial for accurately interpreting medical documentation and selecting the correct diagnosis code. For example, cholelithiasis would refer to gallstones since chol- relates to the gallbladder. A simple tip is to create flashcards for common roots like nephro, kidney, hepato, liver, and cardio, heart, to build your medical vocabulary. Question 4. A patient is seen for a follow-up visit for a healing, non-displaced fracture of the right patella. The fracture was treated conservatively 3 weeks ago, and the physician confirms it is healing appropriately. Which seventh character is appropriate for the fracture code? A. Initial encounter. B. D. Subsequent encounter for routine healing. C. S. Sequela. D. G. Subsequent encounter for delayed healing. Answer B. D. Subsequent encounter for routine healing. This question tests the proper use of the seventh character for injuries in ICD-10-CM. The keywords follow-up visit and healing appropriately indicate the patient is in the active healing phase of care. The seventh character D for a subsequent encounter is used for all routine follow-up visits while the patient is healing. An initial encounter, is used only for the first visit where active treatment is provided, while a sequela, S, would be used for a late effect long after the fracture has healed, like post-traumatic arthritis. Remember, if the patient is coming back for a planned checkup during the healing process, it's a subsequent encounter. Question 5. What is the purpose of an Advance Beneficiary Notice of Non-Coverage, ABN? A. To inform a Medicare beneficiary that a service is not expected to be covered and that they will be financially responsible. B. To get pre-authorization from a private insurance company. C. To document a patient's consent for a surgical procedure. D. To appeal a denied claim from Medicare. Answer: A. To inform a Medicare beneficiary that a service is not expected to be covered and that they will be financially responsible. This question assesses knowledge of a key Medicare billing document. The purpose of an ABN is to provide financial transparency and protect both the provider and the patient from unexpected costs. The key phrase is Notice of Non-Coverage, which signals that Medicare is unlikely to pay for a particular item or service because it is not considered medically necessary. By signing the ABN, the beneficiary acknowledges being informed of their potential financial liability before receiving the service and agrees to pay if Medicare denies the claim. An ABN is a proactive tool used before a service is rendered, not a reactive tool for appeals. Question 6. A patient is admitted and diagnosed with sepsis due to an acute E. coli urinary tract infection. How should these conditions be coded and sequenced? A. N39.0, A 41.51. B. A 41.51, N39.0. C. A 41.51, B 96.20. D. B 96.20, N39.0. Answer: B. A 41.51, N39.0. This question tests the critical ICD-10-CM sequencing guideline for sepsis caused by a localized infection. The keywords are sepsis due to a UTI, which establishes a clear cause and effect relationship that must be coded correctly. According to official guidelines, when a localized infection progresses to sepsis, the code for the systemic infection, sepsis, is sequenced first, followed by the code for the localized infection. In this case, A 41.51, sepsis due to Escherichia coli, is the primary diagnosis, and N39.0, urinary tract infection, site not specified, is secondary. A great way to remember this is that the most severe, life-threatening systemic condition, sepsis, takes precedence in sequencing. Question 7. A patient receives an injection of 50 milligrams of drug X in the physician's office. The HCPCS Level 2 code for drug X is J1234, which is described as injection, drug X, 25 milligrams. How should this be reported on a claim? A. J1234. B. J1234, J1234 on 2 lines. C. J1234x 2 units. D. J1234 with a note in the chart. Answer: C. J1234x 2 units. This question assesses the correct way to bill for drugs using J-codes and units. The key is to compare the dosage administered, 50 milligrams, with the dosage per unit in the code description, 25 milligrams. To determine the correct number of billable units, you must divide the amount administered by the amount per unit. 50 milligrams/25 milligrams equals 2 units. Therefore, the service is reported as J1234 with a 2 in the units field on the claim form to ensure proper reimbursement for the full amount of the drug used. Always check the drug description in the HCPCS manual to see how many milligrams or micrograms constitute one billable unit. Question 8. A chest X-ray is ordered with postanterior, PA, and lateral views. How should this service be coded? A. Code for 1 view chest X-ray, multiplied by 2. B. 1 code for a 2 view chest X-ray. C. 2 separate codes, 1 for a PA view and 1 for a lateral view. D. 1 code for a PA view with a -52 modifier for reduced services. Answer, B. 1 code for a 2 view chest X-ray. This question is about bundling in radiology coding and selecting the most specific code. The CPT manual has specific codes for radiological examinations based on the number of views taken, and the key is recognizing that PA and lateral views together constitute a standard 2-view chest X-ray. This service is reported with a single, dedicated code, e.g., 71046, that accurately describes the entire procedure. It is incorrect to bill for each view separately or to multiply a single view code, as this would be considered unbundling. Always look for a combination code that accurately describes the complete service performed before coding the components individually. Question 9. A surgeon excises a single skin lesion and sends the specimen to pathology. The pathologist performs a gross and microscopic examination to provide a diagnosis. What is the correct CPT code category for the pathologist service? A. 88,300 to 88,309, surgical pathology. B. 88,160 to 88,162, cytopathology. C. 80,500 to 80,502, clinical pathology consultation. D. 85060, bone marrow smear. Answer, A. 88,300 to 88,309, surgical pathology. This question tests your ability to identify the correct category of pathology services based on the specimen type. The keywords excises a single skin lesion and gross and microscopic examination point directly to surgical pathology, which involves examining tissue specimens. The codes in the 88,300 to 88,309 range are assigned based on the complexity and type of specimen being analyzed. Cytopathology involves examining cells, like from a Pap smear, while a clinical pathology consultation is a review of data, not a direct examination of a tissue sample. Think of surgical pathology as the examination of solid tissue removed from a patient to arrive at a diagnosis. Question 10. A patient is diagnosed with both type 1 diabetes, E10, and type 2 diabetes, E11. Under code E10 in the ICD-10-CM tabular list, there is an excludes 1 note for type 2 diabetes, E11. What does this instructional note indicate? A. The two codes can be reported together. B. The two conditions are unrelated. C. Type 2 diabetes should be coded first if present. D. The two conditions cannot be coded together. Answer, D. The two conditions cannot be coded together. This question focuses on understanding the powerful excludes 1 note in ICD-10-CM, which is a critical coding convention. An excludes 1 note is a strict instruction meaning that the two conditions listed are mutually exclusive and therefore should not be coded together. The keyword is excludes 1, which acts like a stop sign for coders, as a patient cannot clinically have both conditions simultaneously. If documentation is contradictory, the coder must query the provider for clarification before assigning a code. A helpful way to remember the rule is, excludes 1 means not with, while an excludes 2 note means not included here, but the two codes could be reported together if the patient has both distinct conditions. Question 11. Which of the following services is typically included in the global surgical package for a major procedure and is not separately billable? A. The initial E/M visit where the decision for surgery was made. B. Treatment for a complication requiring a return to the operating room. C. postoperative follow-up care related to the surgery during the global period. D. A diagnostic endoscopy performed 1 week before the surgery. Answer: C. Postoperative follow-up care related to the surgery during the global period. This question tests understanding of the global surgical package concept, which bundles services related to a surgery into one payment. The keyword is included, asking what is covered by the surgery's main fee. The global package fee covers the procedure itself, local anesthesia provided by the surgeon, and all routine postoperative follow-up care related to that specific surgery within the designated timeframe, typically 90 days for major surgery. Complications requiring a return to the OR and the initial E/M visit where the decision for surgery is made are typically billed separately with appropriate modifiers. Think of the global package as a bundle deal that includes the surgery and all its normal, expected aftercare. Question 12. The wrist is ________ to the elbow. A. Proximal. B. Medial. C. Distal. D. Anterior. Answer: C. Distal. This question tests fundamental anatomical directional terms used to describe the location of body parts. The keywords are wrist and elbow, requiring an understanding of their relationship on a limb. Distal means farther from the point of attachment or origin of a limb, the torso, while proximal means closer. Since the wrist is farther down the arm from the torso than the elbow is, the wrist is distal to the elbow. For example, the fingers are distal to the wrist. A great tip is to think of distal as being more distant to help remember its meaning. Question 13. A patient is diagnosed with hypertension and chronic kidney disease, CKD, stage 3. The physician's documentation clearly states the CKD is a result of the hypertension. How should this be coded? A. I10, N18.3. B. I12.9, N18.3. C. N18.9, I10. D. I12.9. Answer: B. I12.9, N18.3. This question involves using an ICD-10-CM combination code, which correctly links two conditions with a documented cause-and-effect relationship. The key is the documented relationship CKD is a result of the hypertension. ICD-10-CM has a hypertensive chronic kidney disease category, I12, that combines both diagnoses into one code when this relationship exists. The correct primary code is I12.9, hypertensive chronic kidney disease with stage 1 through stage 4 chronic kidney disease, and a secondary code, N18.3, chronic kidney disease, stage 3, must also be reported to specify the exact stage. Always look for a combination code first when documentation links two conditions, as it is more specific and often a coding requirement. Question 14. A patient with a family history of colon cancer presents for a routine screening colonoscopy. The patient has no signs or symptoms of disease. What type of ICD-10-CM code would be used as the primary diagnosis to justify the medical necessity for the screening? A. AC code for malignant neoplasm. B. An R code for signs and symptoms. C. AD code for benign neoplasm. D. AZ code for factors influencing health status. Answer: D. AZ code for factors influencing health status. This question assesses the proper use of Z codes for preventative services. The keywords family history and routine screening indicate the visit is not for an active problem but for preventative care due to a risk factor. Z codes are used to report encounters for reasons other than a current illness or injury, such as screenings, aftercare, or to note a patient's personal or family history that may impact their health. In this scenario, a Z code for family history of malignant neoplasm of the colon, Z80.0, would be sequenced first to show medical necessity for the screening. Think of Z codes as explaining the why of the visit when the what isn't a current sickness. Question 15. A surgeon performs a complex repair of a 3.0 cm laceration on the trunk and also performs a separate simple repair of a 1.5 cm laceration on the leg. The add-on code for a complex repair is for each additional 5 cm or less. How would you code these two repairs? 13101, 12001. B. 13101 plus 13,102. C. 12001, 12001. D. 13,101 only. Answer: A. 13101, 12001. This tricky question tests the rules for coding multiple laceration repairs of different complexities and locations. The key is understanding that repair lengths can only be added together when they are of the same complexity, e.g., simple, intermediate, complex, and within the same anatomical group defined in CPT. Since one repair is complex and the other is simple, and they are in different locations, trunk and leg, their lengths cannot be added together and an add-on code is inappropriate. The correct approach is to code each repair separately with its own CPT code. Remember to only group repairs that are identical in type and location group. Question 16. A procedure described as cholecystectomy is the surgical removal of the A. Colon, B. Appendix, C. Gallbladder, D. Spleen. Answer: C. Gallbladder. This question tests medical terminology, specifically the components of procedural terms. The word can be broken down into its roots to find its meaning. Cholecyst- is the root word for the gallbladder, and ectomy is a common suffix meaning surgical removal. Therefore, a cholecystectomy is the surgical removal of the gallbladder. Understanding these word parts is like having a secret decoder ring for medical records, allowing for quick identification of the procedure performed. For example, an appendectomy is the removal of the appendix, and a splenectomy is the removal of the spleen. Question 17. Which of the following best describes the minimum necessary standard under the HIPAA privacy rule? A. Only the patient's primary care physician can access their complete health information. B. Healthcare workers should only access, use, or disclose the minimum amount of protected health information, PHI, needed to accomplish a specific task. C. Patients must provide a written list of everyone who can access their records. D. All medical records must be destroyed after a minimum of 7 years. Answer: B. Healthcare workers should only access, use, or disclose the minimum amount of protected health information, PHI, needed to accomplish a specific task. This question evaluates knowledge of a core HIPAA privacy rule principle. The minimum necessary standard is a fundamental concept designed to protect patient privacy by limiting unnecessary access to their health information. The key idea is that individuals should only see the specific information required to do their jobs. For example, a hospital billing clerk needs to see patient demographics and a list of services provided to create a claim but does not need to read the physician's detailed clinical notes about the patient's condition. Think of it as a need-to-know basis for accessing patient data to prevent unauthorized or excessive disclosure of sensitive information. Question 18. When coding for an accidental poisoning by an anti-allergic drug, initial encounter, the correct code is T45.0x1A. What is the purpose of the X in this code? A. To indicate the encounter is for a sequela. B. It is a placeholder to allow for future expansion of the code. C. It is a placeholder to ensure the 7th character is in the correct position. D. To signify that the poisoning was intentional. Answer: C. It is a placeholder to ensure the 7th character is in the correct position. This question tests the specific function of the placeholder X in ICD-10-CM coding. The key concept is that certain codes, particularly in the injury and poisoning chapter, require a seventh character to provide more detail about the encounter, initial, subsequent, or sequela. When a code has fewer than 6 characters but needs a seventh character added, the X is used to fill any empty character spaces. This ensures that the seventh character always stays in the seventh position, maintaining the structural integrity and validity of the code. So, the X in T45.0x1a simply holds the 5th character spot so that it can correctly be placed in the 7th spot. Question 19. When coding an Office E/M visit based on total time, which of the following activities can be included in the time calculation? A. Only the time spent face-to-face with the patient and/or family. B. Only the time the physician spends documenting after the patient has left. C. All time spent by the physician or other qualified healthcare professional on the date of the encounter related to that visit. D. The time spent by clinical staff taking vital signs and rooming the patient. Answer: C. All time spent by the physician or other qualified healthcare professional on the date of the encounter related to that visit. This question addresses the modern rules for E/M coding based on time, which were updated in 2021 for outpatient visits. The key change is that total time now includes both face-to-face and non-face-to-face time that the billing provider personally spends on the patient's care on the day of the visit. This can include preparing for the visit, reviewing records, performing the exam, counseling the patient, ordering tests, and documenting the encounter in the health record. A good way to think about it is that any time the provider is working on that patient's case on the encounter date counts towards the total time for coding. Question 20. A patient undergoes a colonoscopy, during which a polyp is removed from the sigmoid colon. Later in the same operative session, a separate, unrelated lesion is biopsied in the transverse colon. Which modifier would likely be appended to the biopsy code to ensure it is paid? A. -51, multiple procedures. B. -59, distinct procedural service. C. -76, repeat procedure by same physician. D. -25, significant, separately identifiable E/M service. Answer: B. -59, distinct procedural service. This question tests the appropriate use of modifier -59, one of the most important and frequently misused modifiers. The keywords are separate, unrelated lesion in a different location, transverse colon versus sigmoid colon. Modifier -59 is used to indicate that a procedure was distinct or independent from other services performed on the same day, such as being performed on a different anatomical site or for a different clinical reason. In this case, it tells the payer that the biopsy was not an incidental part of the polyp removal but a completely separate procedure, preventing it from being incorrectly bundled and denied. Think of modifier -59 as your way of saying, stop and look again. This really was a separate procedure. Question 21. A patient is diagnosed with primary osteoarthritis in both knees. In the ICD-10-CM code set, there are codes for right knee, left knee, and bilateral. Which of the following would be the most specific and correct way to code this diagnosis? A. A code for osteoarthritis of the left knee and a separate code for osteoarthritis of the right knee. B. A single code for bilateral osteoarthritis of the knees. C. A code for unspecified osteoarthritis of the knee. D. A code for osteoarthritis of the lower leg, unspecified. Answer: B. A single code for bilateral osteoarthritis of the knees. This question highlights the importance of laterality and specificity in ICD-10-CM. The keyword is both knees, which directly translates to the term bilateral. ICD-10-CM provides codes that specify laterality, right, left, or bilateral, and coding guidelines require coders to always select the most specific code available that fully reflects the physician's documentation. Using a single bilateral code is more accurate, concise, and efficient than reporting two separate codes for the right and left sides. Always choose the bilateral code when the condition affects both sides and a specific bilateral code exists, as it provides the highest level of detail in a single code. Question 22. A patient with chronic obstructive pulmonary disease, COPD, is prescribed a standard stationary oxygen concentrator for home use. Which coding system would be used to report the equipment itself for billing? A. CPT. B. ICD-10-CM. C. HCPCS Level 2. D. DSM-5. Answer: C. HCPCS Level 2. This question tests knowledge of the different code sets and their specific purposes. The keyword is equipment, specifically a stationary oxygen concentrator, which falls under the category of durable medical equipment, DME. HCPCS Level 2 codes are used to report medical supplies, equipment, and services not found in the CPT manual, including ambulance services, injectable drugs, and DME. CPT is for physician procedures, ICD-10-CM is for diagnoses, and DSM-5 is a manual for psychiatric diagnoses. Remember, if you are coding for a thing, like a wheelchair, drug, or oxygen tank, rather than a doctor's action, like an exam or surgery, you'll almost always be looking in the HCPCS Level 2 manual. Question 23. A cardiologist is asked by a patient's primary care physician, PCP, to evaluate a patient for chest pain, render an opinion, and send a formal written report back to the PCP. The PCP will then use this information to continue managing the patient's care. For most commercial payers that still accept them, what type of E/M service would the cardiologist report? A. New patient office visit. B. Established patient office visit. C. Inpatient consultation. D. Outpatient consultation. Answer: D. Outpatient consultation. This question tests the definition of a consultation service, a specific type of E/M encounter. The key elements that define a consult are the request for an opinion from another provider, the specialist's rendering of an opinion, and the report back to the requesting physician who maintains care of the patient. An outpatient consultation, codes 99,242 to 99,245, precisely describes the scenario where a specialist is asked for their expertise on a specific problem. It is important to note that while Medicare no longer accepts consultation codes, many private payers still do. A helpful tip is to remember the 3 R's of a consult: request, from a provider, render, an opinion, and report, back to the requester. Question 24. A surgeon performs a new, innovative surgical procedure for which no specific CPT code exists. What is the correct way to report this service? A. Use a CPT code that is close to the procedure performed. B. Do not bill for the service until a new CPT code is created. C. Use an unlisted procedure code from the appropriate section of the CPT manual and submit a special report. D. Use a miscellaneous HCPCS Level 2 code. Answer: C. Use an unlisted procedure code from the appropriate section of the CPT manual and submit a special report. This question covers the protocol for reporting services that are not specifically described in the CPT manual. The keywords new, innovative procedure, and no specific CPT code exists point directly to the need for an unlisted procedure code. The correct action is to select the unlisted code from the anatomical section in the CPT book that most closely matches the service, e.g., unlisted procedure, musculoskeletal system, general, and submit it with a special report. This report details the procedure, the effort involved, the equipment used, and why it was necessary, allowing the payer to determine a fair reimbursement. Always remember that for a procedure not in the book, an unlisted code plus a detailed explanation is the only accurate and ethical way to bill. Question 25. A patient receives a bilateral knee injection for osteoarthritis. The procedure code is 20610, arthrocentesis, aspiration and/or injection, major joint or bursa. Which modifier combination would be the most common and appropriate way to report this service to a payer that accepts it? A. 20610 to 50. B. 20610 LT on one line, 20610 RT on a second line. C. 20610 to 25. D. 20610 to 59. Answer: A. 20610 to 50. This question tests the proper use of modifiers for bilateral procedures. The keyword bilateral indicates that the same procedure was performed on both sides of the body, both knees. Modifier -50 is specifically designed to report a bilateral procedure, which indicates to the payer that a single procedure was performed symmetrically on both sides during the same session. While some payers may require separate lines with LT, left, and RT, right, modifiers, modifier -50 is the most widely accepted and efficient method. Just remember, when you see bilateral for a single CPT code, your first thought should be modifier -50.